that mean we can get vaccines for things like cancer, for AIDS, for everything?
Not immediately, but the dream is yes. A lot of the funding for these mRNA companies is for cancer-related vaccines. And part of the beauty is that even if the thing you're trying to attack in the cancer, only a small number of people have it, it's so easy to change the instructions in the vaccine. You don't have to build a whole new factory and verify the factory. You just type those numbers in, and hopefully the regulator sees, oh, you're just doing this small thing. Go ahead, particularly for cancer, where the outcome, if you don't treat the patient, is very poor. It's not healthy people that you're treating. And so when people look at the three mRNA companies, CureVac, Moderna, BioNTech, they each have cancer groups that they're excited about. They can also make medicines that have been expensive, protein medicines like growth factors, and they'll try to do quite a few vaccines. So yes, it's a much easier way of making the vaccine because you tell the body to make the spike protein and then have the immune system recognize it and get ready to attack it, as opposed to you actually stick the spike protein in, and you have to do it on top of something, and figuring out what that is kind of hit or miss. And so the factory for mRNA is pretty generic. What Pfizer, they in a typical year before the pandemic made 200 million vaccines in a year. The COVID vaccine, they made $1.5 billion in the first year. And so the scale up of that manufacturing, and as they did that, their cost per unit, it starts at like 60 and is probably, they don't like to say, but probably below $5 at this point.